You're listening to PetLifeRadio.com.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
I remember being a little girl and having recurrent ear infections. They were so painful. I cringe when a pet is presented to me for an ear problem that's been ongoing for several weeks. This pet must have been suffering. Sadly, the owner often can't decipher the signs of discomfort and what's causing them. Ear issues can be frustrating to get under control, and sometimes takes a specialist like my guest today, Dr. Craig Griffin, a board-certified veterinary dermatologist, to clear up the confusion surrounding the cause, control, and prevention. We'll be right back after the short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
We really love pets. There isn't anything we won't do to make sure they're getting the best products and the best care. So when you ask us a question like,
so how do you feel about cat condos?
We can say from experience,
feels like home for her.
Enter the code Dr10, DOCTOR, the number 10, and get 10% off any order. No minimum at petco.com.
FTD's network of over 40,000 florists around the world have been creating beautiful handcrafted arrangements for 100 years. Each arrangement is delivered the same day and backed by FTD's 7-day satisfaction guarantee. For a century, people have trusted their most important occasions to the flower experts at FTD.
Since Pet Life Radio is all about puppy dogs and flowers, our listeners, that's you, can get a 20% discount on your order. Just go to fleurop.com and use the code Dr20 at checkout. FLEUROP.com, code word DOCTOR and the number 20.
How would you like your business to reach out and invite in our audience? We have a brand new trademark concept called Info Seeds. Info Seeds are short 20-second seeds of information about your place of business, practice, or service. We only have a limited number of slots left. For more information, visit
PetLifeRadio.com.
Click on sponsorship information. There you can listen to a sample of Info Seed or email us at
PetLifeRadio.com.
Remember, only a limited number of opportunities are available.
Got questions about your hound's health? Need the facts on Fido's fitness or food? You want to unleash your pup's potential? Well, you've come to the right place with Win with Dogs. Here, we learn how easy it is to naturally improve the lives of our furry friends. So sit, stay, and get ready to win with dogs. With me, Raquel Wynn. Exercise, nutrition, interaction, and love make for one healthy, happy hound. Give yourself the gift of knowledge on demand every week right here at Pet Life Radio with me, Raquel Wynn, and Win with Dogs.
Let's Talk Pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Griffin, it seems as though every day at least one or two dogs or cats present with ear problems. Am I that crazy, or is it really that common of a problem?
Oh, you're not at all crazy. It is a very common problem. And in fact, it's one of the most common reasons dogs are presented to veterinarians for care. So skin disease is by far number one, and itching and gastrointestinal disease is down a ways is number 2, but ear disease is a large part of it. And it's partly because there's so many things that cause it, and it's so complex, it's difficult to get under control.
Now, you're talking about dogs, and yes, I see a lot of dogs. Why is it dogs and not cats?
Well, that's a great question, and there's several explanations. One is the most common cause of ear disease in dogs is allergy, and cats have a lot less allergy. So somewhere between 10 and 20% of all dogs develop atopic dermatitis. And somewhere around 70 to 80%, though some people say as low as 50, but somewhere between 50 and 80% of all dogs with atopic dermatitis get recurrent ear disease. So when you consider that, that basically means that somewhere around 8 to 10% of all dogs in the world are going to walk around with ear disease because of their allergies. And then you have ear disease because of ear mites, and those commonly cause ear disease in cats and dogs. But once you take ear mites out of the picture in the cat, that's the number one cause. In the dog, ear mites is a small proportion. That's one of the reasons you see such a big difference. Other reasons are the cat's ear canal is structurally different. It's not as long and as deep. And so when they do get problems, it tends to not build up in the ear and be as big of a problem. The anatomy of the cat's ear is a little bit different than the dog, even at the eardrum level and the middle ear. When they get a middle ear disease, cats are very difficult because of their anatomical differences. But it definitely is not as common, though certainly we see it in cats.
If you could compare and contrast the human ear versus the dog ear, since I have a feeling we're going to be talking much more about dogs right now than we are cats.
Yeah. The dog ear is a relatively much longer ear canal. It also is shaped differently. So the dog ear canal is almost like an L. There's once you start going down the ear, what we call the external orifice of the opening you see of the ear canal, where there's all those folds in the ear. Once you start down that canal, it's called the vertical canal, and then it bends and it turns and goes towards the center of the head, so to speak. And as it does that, it's in what we call the horizontal ear canal. It ends in what's the tympanic membrane. And in dogs, that vertical and horizontal canal is much longer than it is in people. And that bend, there's some folds in the cartilage that make things, once they get in an ear, it's a lot harder for that ear to drain out and get things out of the ear canal. The overall structure of the ear is fairly similar, though.
I've always been amazed. It's like whoever created dogs in their ears, why all these little cracks and crevices and folds in that outside ear flap, the pinna. Do you have a reason why they have these little folds in those ears?
No.
Oh, good answer.
We actually have them to some degree as well. But yeah, the dogs definitely have a lot more. And I'm sure there was a reason, but I don't know what it is.
All right. Well, I'll let you go on that one. Now, you're talking about ears and ear mites. So often, I'll have a owner come in with a cat, especially a cat, that has this black crumbly debris in their ears. And it's an adult cat, an indoor cat. And they go, oh, yes, it has ear mites. This seems to be one of these problems that we see in kittens. Is it that, like human children, they're more prone to getting head lice because of their association with other children, and we get older, we get smart and don't share brushes and combs? So why are ear mites, at least in my view, seeming to be more of a young dog and cat problem than an older one?
That's an excellent observation, and there actually is a good explanation for that one. The ear mites actually mainly create disease when they stimulate an allergic reaction. That's when it gets more severe. And to be honest, if they stimulate enough inflammation, you can get an infection in the ear, and that will actually kill the mites off. So what happens is young animals don't have a mature immune system yet, and they can get ear mites, and they don't develop the hypersensitivity. All they have is all that debris building up. As they develop hypersensitivity, that's the mother's nature way of making our body become resistant to certain parasites. So over time, if you study cats, 95% of cats have had ear mites. But by the time they're adult, they're resistant to them. Their immune system tends to destroy the mites and make it much more difficult for the mites to survive.
Excellent answer. I knew you'd have the answer to that. Okay, next question for you is, when I was in veterinary school, wasn't that long ago, when I was taking dermatology, they said, okay, how to know what is causing problems. You get an idea. If it's ears and rears, that's going to be a pet that has a food allergy. Is that still a truism, or are all bets off?
Well, all bets are off, though I guess you could win a little money if you gambled because your odds are a little higher. But there are lots of dogs that have environmental pollen allergies, or what we call atopic dermatitis due to environmental things, and they also can have ears and rears. So when you really look at it, there are lots of dogs that have ears with atopy, and also, I told you up to 80%. Well, 80% of food allergy dogs have ear disease. The difference is more dogs with food allergy have that rear end disease, but it certainly is not as preferential for food as we used to think. There are plenty of dogs with atopic dermatitis that have it, and then also there's lots of dogs who develop flea allergy, and flea allergy makes the rear end real bad. It doesn't cause ear disease, though, but a lot of dogs with flea allergy also have atopic dermatitis. So then you still end up with a combination of the rear end and the ears. So you wouldn't want to gamble too much on that diagnosis, but you are correct that the suspicion for food allergy is higher when they present with mainly the rear end and the ears.
All right, and you keep mentioning atopic dermatitis. For the listeners, please define that term.
Atopic dermatitis is when a dog develops a hypersensitivity or an allergic reaction to things that are found normally in the environment that in a non-atopic person or dog will not cause disease. And so what's typically happening is young dogs, as they're exposed to the world and that immune system is developing, some of them have, and there's a variety of reasons why, but some of them have a predisposition to develop an allergic reaction to those things. And the most common one is house dust mites. But dogs can become allergic to house dust mites, cotton, human dander. So some people think, they can get allergic to the dogs and cats. Well, in fact, dogs get allergic to people as well. And they can be allergic to cats and pollens of weeds, trees, and grasses. And depending on what they develop an allergy to, once that happens, the ear is one of the most common places that is affected. Now, in most of the cases, if you pay close attention, besides their ear disease, these dogs are going to be licking their paws or maybe rubbing their face or scratching somewhere else. And that's a clue that they have developed an allergy, and that's what's affecting the ear, but there's other signs as well. So it's such a common disease, since it affects somewhere between 10 and 20% of dogs, that's why we end up with so much ear disease.
Well, I don't feel so badly where I can't always come up with the answer and make it go away. And I have a feeling you're going to tell me that, right, and the listeners, we're not going to make it go away, that control is all we can really hope for. Is that correct?
That is correct. You do have, and it's controversial as how many, but a small percentage of dogs can outgrow their allergies. So if that happens, it could go away. And then there is a treatment, there's a treatment called allergen-specific immunotherapy that has a small percentage of cases that it will cure, but almost everything we do to treat and manage atopic dermatitis in the dog is usually something that you're doing to control things or to keep things less of a problem, and so that does mean you're going to do it long term. Where it gets real complex is the allergy ear disease is generally very mild. And so most of the time, people aren't even bringing the dog in because of the allergy in the ears. They're bringing them in because of the infections. So this is what makes ear disease, when you talked about the frustration. Well, what makes ear disease so frustrating is most dogs that have had ear disease for more than several weeks or have had it repetitively, they don't have one diagnosis. They usually have somewhere between 2 and 8 diagnoses. And you could even put them on a perfect allergy drug, but if you're not also treating the secondary infection and the proliferative changes in the ear and the stenosis that occurs in the ear canal and the glandular hyperplasia, that allergy treatment won't work. So that's what makes this so frustrating is it's important that all components of the ear problem be figured out, and there's actually different treatments depending on which component you diagnose.
I know clients come in and they almost defiantly bring in this huge bag of medications, throw it down on the table and say, hey, look, I've been using all of this. You keep giving me the same medicine over and over again, and the problem keeps coming back. So it's not that we're not sending home the right medication. It's just it's going to keep flaring up. Is that about right?
Well, I mean, you can prevent that. So the thing is if you think I'm going to treat the ear infection and that goes away, but then I don't have to do anything, then yes, it's always going to come back. What you have to do is get rid of the ear infection, and then you have to change the treatment to something that keeps the allergy controlled. And if you keep the allergy controlled effectively, then you won't keep having it come back. However, you won't be able to stop doing the treatment for the allergy. So I have clients that they literally have to clean their dog's ear once every 2 weeks, and once every week they may put some drops on the ear flap and down in the ear to control the allergies. And if they do that forever, the dog does great. But if they stop or they back off, or if the dog goes into an allergy season, let's say this dog's allergic to Bermuda grass pollen, and now it's June and there's lots of Bermuda grass in the air, what you were doing when there was no Bermuda grass may have controlled the dog, but once the Bermuda grass flares up, the dog may no longer stay controlled. So you have to pretty much, this is what also makes it a frustrating, and some people think confusing. It's not really confusing, it's just that it's complex. And so you have to learn for every individual case, what are the components of that dog's problem, and how do I best manage each one of those components? And that's where we always, well, I shouldn't say we, that's where many people go wrong, is they keep targeting one aspect. I mean, we see lots and lots of cases that are sent to us for chronic yeast and ear infections. Well, yeast is never the primary problem. So you virtually never have a dog with just a yeast ear infection. There's always something else to treat. But if all you do is treat the yeast, they'll get better, but it'll be temporary usually.
My guest right now is Dr. Craig Griffin. He is a board-certified veterinary dermatologist, and he's helped clean up the problem of ear infections and ear problems in dogs. We'll be right back after the short break to learn more about how to take care of your pet's ears. Stay tuned.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Love your pets but wish their medications were a lot less expensive? They are at 1-800-PET-MEDS. You'll not only save on flea and heartworm medications, but on prescriptions for arthritis, incontinence, thyroid, and more. And you get fast service, free shipping, and a 100% satisfaction guarantee. Plus, our licensed pharmacists ensure accuracy, monitor drug interaction, and more. See why over 5 million people have trusted their pet's health to 1-800-PET-MEDS, America's largest pet pharmacy. Call now or order online.
Go to petmeds.com/doctor, DOCTOR, to get 10% off any order and free shipping on orders of $39 or more at petmeds.com.
There's a movement afoot, shoebuy.com. Join the millions of people who shop shoebuy.com's over 400 brands and 500,000 products. Order now and get free shipping and free return shipping. shoebuy.com, the world's greatest shoe store.
Walk your dog in style and comfort. Enter the code DOCTOR, DOCTOR, at checkout and get a 10% discount plus free shipping at shoebuy.com.
How would you like your business to reach out and invite in our audience? We have a brand new trademark concept called InfoSeeds. InfoSeeds are short 20-second seeds of information about your place of business, practice, or service. Is the best, most cost-effective way to invite us in. We only have a limited number of slots left. For more information, visit the website
PetLifeRadio.com.
Click on sponsorship information. There you can listen to a sample of InfoSeed. Remember, only a limited number of opportunities are available.
Hi, this is Marcy Davis and my service dog Whistle, and we're your hosts of Working Like Dogs on Pet Life Radio. Working Like Dogs is the show where you can learn everything you ever wanted to know about working animals or working dogs. Whether you're a member of a working dog team or you've just seen a working dog or animal out at the mall or the grocery store and you're curious about how these amazing animals work with their human partners, then Working Like Dogs is the show for you. Join us for the inside scoop at Working Like Dogs on PetLifeRadio.com.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
So, Dr. Griffin, all right, we're talking about cleaning ears and controversy back and forth to pluck those ears that have extra hair in it, not to pluck it. What do you say?
Well, currently, I say no, you should not pluck the ears in a dog who is normal and healthy and doesn't have ear disease. And literally there's dogs where you go to examine their ears, you can't even see their eardrum, yet they're normal. They're having no symptoms. In that situation, I don't usually do anything. If the dog is prone to ear disease, or let's say it has allergies and it's prone to recurrent infections, that hair in the ear becomes one of those other factors that makes things worse. So in that situation, some dogs are benefited by plucking the hair. So there is a school of thought, and I was actually trained, and for many years I would tell people to routinely pluck the hair out of their dog's ears. But it actually, in some dogs, creates disease. You pluck the hair, and they can have what's called attraction folliculitis, and then they get an ear infection, start shaking their head, and it ends up being worse. So because of that, and plus people put various powders and cleansers in at the same time that you're plucking the hair, well, just imagine if you rip your own hair out, and at the same time you're rubbing some of these things on the skin, they're more likely to be irritating than if you applied them to healthy skin.
And cleaning ears. One of the things I'll always ask when a client brings in a pet, especially if it's one I've never seen before, even if one of my other colleagues at my practice has been seeing, it's like, okay, how do you clean your pet? Do you bathe it at home? Do you take it to the beauty shop? What's your routine? And try to set them up so, okay, oh yes, I bathe it all over and I wash the head, and, I try not to get water in the head, into those ears. Your feelings of people bathing their dogs at home. What is your correct way for doing it? What do you recommend?
Well, there's multiple ways to do it. So there is no, this is the only way to do it, to be honest. If you are going to wash the dog and get fluid around their ears and head, and the fluid gets in the ears, then it is at least a good idea to rinse them out with an ear cleanser, so you're not leaving any soap, detergent, or even water in the ears. So the ear cleansers and the ear drying solutions will remove that. So it's kind of like we don't tell people you can't swim, and people who swim and get water in their ears and are prone to swimmer's ear, then yes, they use things to dry the ears out and to manage that after. If you want to put cotton balls or things in the opening of the dog's ear to prevent water from getting in, that's fine as long as you remember to pull them out. And even if you soak those cotton balls, if they get too much water in them, they'll still get fluid dripping down below them. So if they come out wet, then you still should use a drying agent if your dog's prone to ear problems. And if you get soap in there, you definitely have to rinse them. I'm not telling people they have to do it any one way. I'm telling people to be aware that if you leave water in dog's ears, it can lead to a problem. If you leave soap in the dog's ears, it routinely leads to a problem. You don't want to do that.
One of the suggestions that I've given clients, because oftentimes they'll want to use peroxide, and it's like, well, peroxide turns into oxygen and water, and since ear wax is kind of oily, they don't always blend well, so use a specific ear cleaning solution. Flood the canal, massage it around, let it shake out the excess. And I know I've seen so many dogs, even in practice, pick up that bottle of ear cleaner, put in the ears. Since it's colder than that dog's body temperature, they really dislike it. So I usually tell them to warm up that ear solution until it's baby bottle temperature. Then they have a spa sensation. It feels so much better to put that in the ears.
You're absolutely right. That's the perfect way to do it. So it is better to use a routine cleanser, and it is definitely more comfortable to have it at body temperature than cold. And the filling the ear up, not just a few drops, massaging it, letting the dog shake it out. And then at that point, usually we tell people to take either a Kleenex or a cotton ball and wipe the opening of the ear. Wipe those folds, those little folds that are there that we wonder why. You want to wipe those clean because that's what actually catches. That's where all the wax and material that comes from down in the ear canal, that ends up in those folds and crevices. So you want to clean those out. But what you definitely want to make sure is nobody takes Q-tips or cotton-tipped swabs and sticks them down the ear canal. Because what you're going to do is any earwax or anything that's left in that ear canal, you're going to push it down towards that turn. You never want to see a tip of the Q-tip or a tip of anything go to the point where you can't see the tip of it. So that's why I usually recommend just Kleenex on your fingertip and wipe the crevices and opening to dry that out.
And Dr. Griffin, you keep talking about allergies causing these ear problems. And yes, the food being a possible cause, the ears being inflamed, the little hindquarters right around the rectum being inflamed also. I'll have clients who come to me who've had allergy testing elsewhere and they say, oh yes, my dog is on this special diet because I had a food allergy test done and it's allergic to X. I know there's controversy back and forth about food allergy testing being done via a blood test. I would love your input on that.
Well, to be honest, it's not very controversial among most specialists who study the field. They're not very accurate. So the controversy is because occasionally those tests will predict or show what the dog is correctly allergic to, and you can change the diet based on that recommendation and the dog will get better. However, all the studies that have been done have shown that it is not accurate enough that you can rely on it. So if you did change your diet and the ears stayed a problem, it doesn't mean the dog doesn't have food allergy. And it doesn't mean the diet they told you would fix it will fix it. So because of the poor accuracy of the test, then I usually don't spend money on those tests. I would rather have people change diets to diets that we know have a higher probability of not causing food allergy. So it's really, how accurate it is the part that's controversial, but I know of no specialist who would tell you it's highly accurate.
But the accuracy for the blood test for inhaled allergies, the house bites you're talking about, what's the specificity of that? Would you say that, yes, it's good?
Well, it's probably better, but to be honest, it hasn't been examined as closely. The basis for saying that the blood allergy test for environmental allergies is better than the food test is the fact that if you do blood allergy tests and you then go through immunotherapy, which is considered a treatment that only works if you treat the right things, that's effective. So based on that kind of cause and effect or that relationship that, well, if I do blood allergy tests and I treat with allergy serum, it works. And we know if you treat with what we say is nonspecific serum. So there was a study where they actually treated dogs just with the most common standard allergens that were in the environment, and those dogs didn't do very well. The dogs who had been treated based on their allergy test results had a statistically significant better response. So based on those types of studies, we feel that it's a better test. But to be honest, very few studies have actually challenged dogs and documented how accurate that test is even.
And speaking of accuracy, are pet owners accurate when they say, oh, my pet is on a grain-free diet because it's the grains that are causing the problem, soy, corn, whatever?
Well, they might be lucky enough to be accurate. The problem is some dogs are highly grain allergic, some dogs are highly beef and animal protein allergic. If you read the literature, the beef and the dairy products are considered a more common cause than the grains. So based on what's been published, you could argue that no, their statement is more often wrong than correct. However, again, the problem is if you read and you pay close attention to how those studies are done, they weren't designed to truly answer that question. And we certainly do see plenty of dogs who will react to corn or wheat or even oats, and we have dogs allergic to potatoes and rice. And so all these dog food out there that say we contain ingredients dogs aren't allergic to, they're incorrect as well, because actually some dogs are allergic to those ingredients.
So what do you have for that pet owner that has the poor dog with a chronic problem? Is there something new, special, fantastic that you're working on that gives us hope?
Well, depending on what's causing their problem, the answer is yes. There's new allergy treatments being worked on. There are better and better dog foods for, and when I say better, I'm not saying that they always work, but there are more variety of dog foods that offer a chance of fixing food allergy. There's new equipment that is allowing us to do a much better job to examine the ears and determine what's wrong in an ear. And we are learning a lot more about all the different complexities once you get an ear infection and what starts happening in that ear. I mean, most people, it's intuitively obvious when you tell them this, but most people don't realize the ear is one place on the body that's self-cleaning. In other words, you produce material from the surface of your skin 24 hours a day, 365 days a year. And on the surface of your skin, it just flakes off into your clothes and into the environment. In your ear, it migrates out to the opening of the ear canal. And that's why you see all the earwax on the outside of your ear, or at the opening. It's not down in the ear canal because that's a very specialized area of skin on your body. And when dogs, and for that matter, cats and people, get ear disease, there's a point where that cleaning mechanism gets destroyed. And so we've learned a lot about how really to fix ears, you have to keep cleaning them until that comes back to normal. And if it doesn't come back to normal, even if you've cured the allergy, they constantly have ear disease. So we're developing better and better treatments for allergies, better and better treatments for ears, better ways of recognizing what's wrong in these things, and we're making a lot of progress. But it's understanding that it's not as simple as saying it's one thing. It is very complex. If you start understanding all the parts, we do have more and more tools, and there's a lot of breakthroughs right around the corner. In fact, we're now even testing dogs' hearing, where we have the ability to electronically test whether a dog can hear well or how much hearing loss they've had from chronic ear disease or from ear infections. So there's more and more coming out.
So this hearing test, people have oftentimes asked me, well, especially with that older dog, I think it's lost its hearing. It doesn't hear when I come home and I call its name. I have to come up to it and touch it in order to get its response so it knows that I'm here. How do you do this hearing test in a dog? I say get 2 pots and pans when it's not watching, and bang it together and see if it turns around. It's not accurate, but it works.
It does work, and it's not as accurate. They're actually, what always amazes me is how many people don't know their dog is deaf. So what you just described definitely happens. But as far as working on dogs with ear disease, I see more clients who think their dog hears pretty well, and in fact it is either deaf or it hears very, very poorly. And so you are right, banging things and all those, but the problem is when you get to that point that a dog can't hear, they're usually deaf. There's a lot of hearing loss that can occur before that, and the question is can you start reversing things and stopping it before they get deaf.
So this is a real sequelae to this chronic ear infection, is losing some hearing. What else can be the sequelae, the results of having that ear infection that you just never truly get under control?
Well, you started off talking about the pain of ear disease. And in fact, most people don't realize how much pain their dog is in. Where it's most traumatic to me as well, it's a dog that comes in, it's got chronic ear infections, and we truly can't help it very much. And we have to send it to a surgeon, and they surgically remove all that diseased tissue, basically in a day it's gone. By the time they've healed and they're over the post-operative discomfort, owners are saying, my dog acts like a pet again. It'll shake its head, it'll run up and down stairs. A lot of dogs with chronic ear disease are living with a migraine headache. And they don't want to shake their head because it hurts. So in reality, seeing a dog feel that much better is a rewarding thing to fixing bad ears. And the sequelae of chronic ear disease is, yes, they can go deaf, but probably it's the fact that they live in chronic pain and discomfort. And I think dogs compensate for deafness so well that I suspect the pain and discomfort is even worse. I mean, we're using more and more pain medicines for some of our chronic ear cases because of that. It's a difficult pain, as you're aware. The chronic pain has what we call a wind-up component to it, and it's more difficult to medicate and treat.
There have been a few times more than a few times that I've recommended it, a few times that clients have gone through with the surgical procedure you're talking about, the ear ablation, where literally that entire canal is gone, is taken out, and you lift up that little ear flap and there's no opening. They go, oh my goodness, but how can the dog hear? It's like, well, the dog couldn't hear before we did this procedure. And yes, I agree with you. Afterwards, they do feel so much better. It's like, thank you, finally.
Yeah, I think those dogs, well, you're right. Often they are deaf before you do it anyway. And to be honest, even if they weren't deaf but their hearing is so impaired that, yes, they may hear a little bit worse when they're done, but they feel a whole lot better.
We've been talking right now with Dr. Craig Griffin. He is a board-certified veterinary dermatologist in Southern California, travels all over also talking about ears. And other things too in dermatology. I want to thank you so much for being with us today. I actually wanted you as a guest because one of our listeners suggested, let's have something talking about ears. So I follow your suggestion. So if you're listening, you have something that you want me to look into further, please drop me a line at the Pet Doctor at PetLifeRadio.com, and I will jump on it as best as possible, because I always want you to be the best possible pet owner that you can be. So Dr. Griffin, thank you so much for being with us today.
Thank you, Dr. Cruz. Appreciate it.
All right, well, you have a good one. I know Dr. Griffin right now is going to try to hit the slopes in Southern California, get some skiing in, so best of luck. Don't break anything, because I'll need you to take care of ears and skin for me. I'll be talking to everyone again next week when we have another segment of The Pet Doctor on Pet Life Radio. Everyone take care.
Pets can be a wonderful addition to your life. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.